Welcome to the program. I'm Felicity Eziwike. Sunday, February 4 was World Cancer Day. One slot will be focusing on this global initiative to raise awareness, improve education, and encourage personal, collective, and government action to reimagine a world where millions of preventable cancer deaths are saved and access to life-saving cancer treatment and care is equitable for all, no matter who you are or where you live. In Africa, between 2022 and 2024, the focus of World Cancer Day is to help close the cancer gap. Now, according to the WHO Regional Director for Africa, Dr. Matshidiso Moeti, this year marks the third and final year of the campaign. The theme for this year is Together we challenge those in power, encompassing the global demand that everyone deserves access to cancer care, for leaders to prioritize and invest in cancer prevention and care, and to do more to achieve a just and cancer-free world. She shares that the cancer situation in Africa is disheartening. In the year 2020, approximately 1.1 million new cancer cases occurred on the continent, with around 700,000 deaths. She says if urgent measures are not taken, cancer mortality in the region is projected to reach about 1 million deaths per year by 2030. Also, in 20 years, cancer death rates in Africa will overtake the global average of 30%. This is more so because cancer survival rates in the WHO African region currently average 12%, much lower than the average of over 80% in high-income countries. Although some progress has been made, the question, are we doing enough to avoid these projections, remains. To discuss the day and the many issues associated with improved care, I am joined by Ransi Chidebe, Executive Director. He's the Executive Director, Project Pink Blue. It's good to have you on one slot. Thank you for giving us your time.
Thank you very much. Thank you so much. I greatly appreciate the opportunity to speak with you.
Let's begin with the awareness. It's observed February 4. Maybe you could start by reminding us of the significance of this day and its objectives.
Okay, so I would really say that World Cancer Day is really a great opportunity created globally to really help to really evaluate what we all have done all over the world about cancer and what needs to be done. And World Cancer Day is such an important day because it helps every country in the world to create awareness, to advocate for better care, to explore and look at where the country is doing well in cancer control and what needs to be done to really improve care. World Cancer Day is such an important opportunity to hold leaders accountable and to really speak out and empower cancer patients to really advocate for themselves, advocate for others, and advocate for the community. So this year's World Cancer Day, the theme is actually Close the Cancer Care Gap. And it's so important because when we talk about gaps in cancer control, the reality is that many cancer treatments are really available in some part of the world, and in other part of the world, some cancer treatments are not available. I can give you a clear example. For breast cancer, for instance, 80%, it's actually 80% survival rate for breast cancer in countries like the US, especially among the Caucasian, right? But in Nigeria, it's actually 30% or even less. That's only breast cancer. This is to tell you that more people are really dying of breast cancer in Nigeria, even though Nigeria have less cancer incidents compared to those other countries like the US and the UK. So these are critical gaps that need to be closed.
Okay, what's being done, before we talk about other things, what's being done to close that gap to your knowledge? Is it enough? Are there areas that need better attention? Who is supposed to be responsible? Who should be more involved?
Okay, thank you very much. So I would really try to explain your question from a different perspective. So the people that are responsible for closing the core gap is actually the government. You can't take that away. It's the government's responsibility to close these care gaps. And in Africa, for instance, Africa have some of the worst access to radiotherapy treatment, for instance, right? You cannot believe that, South Africa, for instance, has one radiotherapy for over 600 people. Tanzania actually have one radiotherapy for about 11 million people. Nigeria, on the other part, has one radiotherapy for 29 million people. This is a very huge gap. This gap cannot be closed just by anybody. It can really be closed by government or maybe some huge private sector investment. The reality about radiotherapy machine is that almost 70% of cancer patients diagnosed in Nigeria, for instance, and in many parts of Africa, will need radiotherapy machine for them to cure or for them to even get remission. Unfortunately, this kind of treatment is not readily available across the region.
Why is that? Why is government not stepping up to close the gap? Is it that they don't understand the urgency required and the rate at which avoidable deaths are occurring in the region?
No, I think the reason why the government would really say the reason why the government are not closing that gap might not be a question that I can answer because I'm not government, neither do I work for the government, right?
Fair enough.
But what I could say from a perception, level is that I think one of the biggest problems we have in cancer control right now, I think two of the biggest problems we have in cancer control right now is that cancer control has been left in the hands of federal government for too long. The federal government is responsible for caring for people impacted by cancer. In Nigeria, for instance, over 120,000 Nigerians are impacted by cancer every year. And you are leaving everything about cancer control in the hands of federal government. The state government have been doing almost nothing, except few states like Kebbi, Oyo, Ondo, and Lagos. In fact, very, very commendable. Lagos have been doing a phenomenal work around cancer. So imagine if all state governments begin to invest in cancer. That will really make a huge difference. River State, for instance, built an entire house, a big building about cancer, for cancer control. But there is almost the building have been under key for several months since the past governor left office. So nothing is really happening there at the moment. The entire south of Nigeria, there is no single government-owned radiotherapy machine in the entire south of Nigeria. The only radiotherapy machine you have in the entire south that is currently working is owned by a private. Is actually owned by a private company. So there is a need to really decentralize cancer control in a country like Nigeria, in a way that state governments can begin to think of how to bring cancer screenings to the primary healthcare level, or even secondary healthcare level. In a way, once a woman at her reproductive age arrives any hospital to get any care, that woman is mandated to do breast or cervical cancer screening. Then maybe treatment capacity can then begin to really grow, and then we can begin to detect cancer early and can really begin to get higher survivorship.
Okay, what you just said reminded me of the conversation around awareness. There is still some misconceptions or myths about the cancer itself, not just among women, but just generally. What are some of these common myths or misconceptions about cancer that you feel requires more exposure, more awareness as we commemorate the day?
Okay, so there are so many myths that people have been really spreading out that are all fake. And one very popular one is that many people believe or have been promoting this notion that, sucking of breasts really can prevent breast cancer. This is absolutely wrong. It's not true. It's a misconception that is coming from breastfeeding. So I think the right information is that breastfeeding could reduce the risk and not even prevent, So this is appropriate to put out there. There are no sufficient data available to show that when, sucking of breast can really reduce that. So when you hear people talking about no bra day, it's just people misquoting or probably, pushing out the wrong narrative out there, right? Other myths I have heard is other myths, surrounding treatment, where people tell you that you can use this herb or you can use this herb or whatever herb, to treat cancer. Those are all false, right? To the best of our knowledge, to the sufficient data that are available, it's only orthodox medicine that can cure or can actually treat breast cancer at this time. What we need to do is that every human being needs to begin to take responsibility in cancer control. The reality is that treatment for cancer in most parts of Africa, especially in Nigeria, is really limited. So if everyone can take action to really, really, really reduce their risk of having cancer or prevent cancer, we all are building the capacity to do what? To reduce the burden of this disease.
Yeah, but before we come to the reduction, I'd like you to maybe, I know there are a lot of cancer that you can't begin to mention all of them, but are there some that are prevalent in these parts of the world, and how can, what attention level should we be given to them, and the ones that people need to be conscientious about checking to see if they have it?
Okay, so in Nigeria today, 124,000 people are diagnosed of cancer every single year, and about 78 really die of this disease every single year. Out of these diagnoses, right, we really have breast cancer, which has become the leading cause of cancer death. Breast cancer is more prevalent than any other. And breast cancer is really prevalent in terms of really the number of people that actually have this disease and also the number of people who die, followed by cervical cancer. In fact, cervical cancer, according to WHO, is now called the cancer of the poor, because few people who are wealthy are able to get vaccination to really prevent cervical cancer. So people who are poor that could not have access to this vaccination are really diagnosed with this disease. Number 3 is actually prostate cancer. Prostate cancer is the leading cause of death among men, and the number 3 among all forms of cancer for both sexes. Then apart from these 3, the other ones that are also leading is colorectal cancer. Colorectal cancer is increasing in the country at this time because so many people are being misdiagnosed. That is because the symptoms of colorectal cancer, which are, for instance, stooling blood, having anal pain, losing weight uncontrollably, and all the rest of them. This could also be symptoms of hemorrhoid. This could also be symptoms of pile. And when people are having these symptoms, sometimes they are misdiagnosed, and the physicians or the healthcare worker think that these things are hemorrhoid or these things are pile or whatever. And then when they were diagnosed, when they eventually get diagnosed, it became too late.
Okay.
Another prevalent cancer, especially in Nigeria, is liver cancer. And liver cancer has not been getting the attention it requires because liver cancer is linked to hepatitis. So many people do not know that when someone, for instance, the federal government introduced hepatitis vaccine in 2014. What that means is that so many of us who were born before 2014 have not received hepatitis vaccine. It means that we are at greater chance of having hepatitis. And for the fact that most of us are at risk of having hepatitis, if we have hepatitis, it means that there is a chances that we could have liver cirrhosis, which could also lead to liver cancer. But
Okay,
many people
it's
who were
quite
born
scary.
before
The
2014.
more you list them, the scarier it gets. But these are preventable, aren't they? And we could also take action to reduce some of these cancers. Talk to us about those measures.
So there are so many things we could really do. As I mentioned, number one is everyone getting hepatitis vaccine. It is very important to really get the hepatitis vaccine to really protect yourself against any form of liver cancer, right? Except the ones that were not caused by the virus. Number two is the human papillomavirus vaccine. The human papillomavirus vaccine, HPV vaccine, we're grateful to the federal government, has been introduced to 16 states. Right now, in 16 states, the HPV vaccine is available for girls who are from the age of 9 to 14 years. What that means is that by May of 2024, according to the CEO of the National Primary Healthcare Development Agency, that they will roll out to more states by May. So from May, more states will have access to the HPV vaccine. Right now, the federal government have vaccinated over 7 million girls. So it's so important for girls, for families, for our parents to really, really allow the National Primary Healthcare Development Agency to really vaccinate their girls. Another thing we could do to reduce our chances of cancer, any form of cancer, really, is limit your alcohol. People need to really reduce the intake of alcohol because alcohol has been implicated in a number of cancers. The next one is bleaching cream. Today, most Nigerians believe that if you don't look fair, if you don't look yellowish, you are no longer beautiful. You are putting on something on your skin that will probably place you at risk of liver cancer in the future.
All right, I'm sorry to interject, Ransi.
I'm in Nigeria, made in locally that does not have NAFDAC number, and they say these are all organic cream. These are putting people in greater risk of skin cancer.
All right, I hate to interject, but the director has just told me we have about 5 minutes, and there's something I want to clarify. Nigerians love alcohol. I personally am a lover of red wine, all kinds of red wine. So there are people who say if you take red wine, you are doing yourself a favor. Is that true, or should we cut down on, how much is too much?
Well, you see, what we know, research, especially from Center for Disease Control and Prevention, the USA research, has said that drinking 3 or more alcohol drinks per day increases the risk of stomach and pancreatic cancer. So there is an evidence that shows that drinking alcohol will increase the risk of prostate cancer as well. So drinking alcoholic drink, including red and white wine, beer, liquor, are all linked to cancer. So I'm not telling you what me, Ronsi, no, I am telling you what a series of research has undergone, clinical trial have shown, right? So what I will recommend is limit, moderation. There are so many people that when you keep 1 carton of liquor, they could finish it in 1 sit. So if people want to really reduce their risk of these cancers, as I stated, stomach cancer, pancreatic cancer, as well as prostate cancer, limit our alcohol. Obesity is one other thing that have remained, people don't talk about that much. And I think it's also important to bring that up, to this very important conversation.
All right. It's important. We all needed that reminder, particularly yours truly, limiting the intake of alcohol. Thank you very much for speaking with us. We appreciate your time and your input. One last word before you go. As we commemorate this day, what would you want everyone to have at the fore of their minds?
Okay, one thing I would really say is that Nigerians want to be more American than the Americans. Nigerians have begun to be more European than the Europeans. We are all consuming all sort of, canned food, hot dog, and all these processed meat and otherwise have been linked to cancer.
All right.
Today we see all this sort of shawarma and all the rest. Please and please prevent cancer as much as you can, because the treatment facilities are not that available as it is in many countries of the world. Thank you so much. That is one gap that every individual can do to close. So closing the care gap is something that we can also do as individual, and then get our community to do and get our government to also do. Thank you so much.
Thank you again. We appreciate your time.
Yeah, thank you.
Thank you for staying with News Central. On the second half of the program, we'll attempt to further explore the implications of the exit of Mali, Niger, Burkina Faso from ECOWAS in terms of trade. Writing for the Daily Trend, DAPO OLAWUNI submits that the abrupt pullout of Niger, Mali, and Burkina Faso from the Economic Community of West African States has fragmented the region's blocs, which is the bedrock of the African Continental Free Trade Agreement, AfCFTA. The submission by maritime stakeholders is that a fragmented economy will negatively affect the agreement, which relies on regional blocs to aid the movement of goods and services across the continent without restrictions. We've had conversations here previously on where we are in terms of implementation of the AfCFTA. While there is more ways to go, how much of a setback will this exit be? My guest is Bamidele Ayemibo, lead consultant, 3T Impex Consulting, Lagos, Nigeria. It's good to have you on the program. Let's begin by just getting, is there something we might have missed? Has there been any development that may just nullify this conversation on the likelihood that these three will come back to the ECOWAS?
No news to that effect yet. It's obvious the reason why they want to pull out. They are not practicing democracy, and West Africa is on their case to return back to democracy, and it doesn't appear it's something that will happen anytime soon. They believe the kind of government they need to be able to make their country better. It's a sovereign nation, so they can take their decision, but the pressure is still much from ECOWAS, and they think pulling out will make them to be able to do whatever they want to do independently. So I don't see anything changing anytime soon. Let's hope for the best.
While we are hoping for the best, what are the possible implication or impact of the exit of this group from ECOWAS on the trade agreement?
This is definitely a setback for AfCFTA, no doubt. And even ETLS in West Africa, these three countries combined have a population of about 70 million people. That's a loss of 70 million market to AfCFTA, 70 million, and GDP of about $80 billion. So even though in terms of GDP, it's not a very large GDP, compared to that country in Africa, but the term of population and purchase as market for AfCFTA and ETLS, it is a significant one that is a loss to West Africa and, of course, to AfCFTA eventually. But the way it appears, it doesn't appear it's going to be an issue for AfCFTA because they are not pulling out of African Union and the agreement they have, which is the AfCFTA agreement. They are pulling out of ECOWAS and the ETLS, which is under ECOWAS. So I'm not sure yet if it's going to really impact AfCFTA. I think we're going to feel more impact in West Africa. I'm not sure they are pulling out of AU. I think it's ECOWAS alone they are pulling out of.
Okay, but what is the difference really? ECOWAS is the Economic Community of West African States, and then AU is just African Union. Yes, it's a union that unifies the whole of Africa, but then again, you have the economic aspect, and that's the core when we talk about the AfCFTA. So could you help us explain that when you say they're not leaving the AU? The fact that they're leaving ECOWAS.
We have two agreements here. We have an agreement
under
ECOWAS, the ECOWAS Trade Liberalization Scheme, under the Economic Community of West African States. Then we have the African Continental Free Trade Agreement that encompasses the whole of Africa, of which Burkina Faso, Mali, and Niger are both signed and ratified. Their pulling out from ECOWAS does not automatically mean they are pulling out from the agreement they've signed and ratified under the African Continental Free Trade Agreement. So I don't see this impacting on the African Continental Free Trade Agreement in terms of implementation. I see it impacting more on the ETLS under the ECOWAS. That's the ECOWAS trade liberalization scheme.
But doesn't the fact that they don't operate a democracy impact their holistic involvement in the AU? The AU is supposed to champion democracy, right? And these countries don't practice democracy. So wouldn't their relationship with the AU be as strained as it is with ECOWAS?
Yes, it is, but it's not affecting the trading agreement, because the trading agreement is a different agreement altogether signed under AfCFTA. For example, we have one or two countries that are yet to sign. I think Eritrea is yet to sign. Benin Republic, I'm not sure, have ratified. So, and they are still member of AU. The fact that they've not signed the AfCFTA does not mean they are not member of AU. So I can be a member of African Union, but I don't want to trade under AfCFTA. And I can be trading under AfCFTA and still be a member of African Union. So the fact that I'm under the geography of, within the geographical region of Africa under AU does not necessarily mean I have to sign to trade with you duty-free. And the fact that I'm under AU means I can also decide to go ahead and sign. So there are two different agreements altogether and should not be mixed together.
Okay, I think that clarification was needed, even though I'm still fuzzy around it. But let's see if we can look at other areas. What then are the potential consequences of these countries' departure and the overall trade integration efforts in Africa? But before you answer that question, I'd like you to, where are we with the implementation of the free trade agreement? Are we, for instance, if we want to be very optimistic, say we're about 50% integration, or we're still way below that? You take that on before you take the next.
Let me use the word, there is a tariff schedule agreement that needed to be finalized, and it's over 90% complete at the level of AU. That's AfCFTA Secretariat confirmed this. Now, but in terms of, I would rather talk about, okay, let me talk also about trading under the agreement. The agreement, trading under the agreement have started with the guided trade initiative that started 2021, 2022, but Nigeria has not started trading, even though, in fact, I saw a news, was it early this week or last week, that South Africa has started trading. A number of other countries like Ghana, like Kenya already started trading, but Nigeria is yet to trade. But in terms of readiness to trade, the fact is that Africa is ready to trade. Trading has started. In terms of the tariff schedule concession, about 90% already agreed. And for me, the agreement is effectively in place, even though many African countries have not started trading, including Nigeria, being among the people that have not started trading under AfCFTA. Okay,
so the part about the integration, the consequences for the integration efforts in Africa, how will this impact it? Because we've made some, you said we've made some progress, but stakeholders are afraid, like I mentioned at the beginning of the program, that it will impact. So what are some of the things we should expect as a consequence of this move?
So I will look at it from West Africa now, because they are pulling out of ECOWAS, which is ECOWAS Trade Liberalization Scheme, ETLS. So that will be impacted definitely. So we expect, of course, a reduction in the market for ECOWAS. About 70 million market is being excluded. ECOWAS population is about 350 to 400 million people, and about 70 million is being pulled out as a result of this agreement. We are losing about 12 billion potential market demand. So when you look at the import volume of Burkina Faso, about $4.5 billion, that of Mali, about $4.56 billion, that of Niger, about $2.3 billion. This is the demand, import demand. So if we are looking at export from West Africa to this country, we are losing out on that huge market of about $12 billion, even though majority of their import is actually from outside Africa. So, for example, Burkina Faso is importing about 30% of Burkina Faso imported from ECOWAS. About 30% also of Mali is from ECOWAS, and 30% of Burkina Faso import also is from ECOWAS. But when you look at Niger, about 25% of import of Niger is from ECOWAS. So when you look at the 30%, 25%, that's a lot of import they are doing from ECOWAS. I see that being a major loss as a result of this. Now, when you look at the map of these three countries are landlocked. But there are some countries after them that if I'm going to Libya, if I'm going to Algeria, if I'm going to Mauritania, if I'm going to Morocco, if I'm going to Senegal, passing through this country under the ETLS make it a lot easier for me to get to those countries by road. With this now, of course, the barrier is expected to return. That means I might not be able to pass through this country duty-free. I might have to pass through the West African coast if I'm going by road, and that will be a longer journey for me. Those are some of the impact I foresee happening within this impact. I mean, as a result of them pulling out of ECOWAS, and of course the impact on the agreement and trade on the West African sub-region.
I'm curious, though. We're talking about the impact of their withdrawal from the bigger picture, like the larger scale, let's say ECOWAS, for instance. What about the countries themselves? How will this decision by their leaders to exit affect the citizens there in terms of trade as well?
You know, what that's interesting, because, and very important question, I must say, you know, their export, and, you know, because ab initio, intra-African trade is very low, 14, 15, 16, 17%. Different people will quote different figure, but nobody is quoting more than 17, 18%. So this country also is part of it. They are not doing a lot of trade with Africa. Take, for example, Burkina Faso export to Africa, which is mainly within ECOWAS, is just about 5%. 76% of the export of Burkina Faso is to Switzerland. When you go to Mali, Mali export to Africa is less than 1%. 78% of the Malian export is to UAE. Look at Niger. Niger export to Africa is just about 10%. 10%. Over about 70% of their export is to UAE. So I really don't see a lot of impact, maybe for informal trade and movement of persons, but in terms of trade, in terms of export, I really, based on the data available, see a lot of impact on them. I guess they have looked at this also and asked themselves, look, in terms of trade, what are we really gaining from this relationship? I think these people are doing more trade with us than we are doing with them in terms of export. Maybe that's the reason they could take that kind of decision. Maybe, I mean, I'm just looking at the data and asking myself, maybe this explains the reason why. So I don't see, in terms of trade, I don't see a lot of impact on them because they are not really doing a lot of trade with Africa ab initio. They do a lot of commodity export, mainly doing gold, and they are doing it mainly to countries outside of Africa.
Interesting. There is this need to negotiate sometimes. How will their withdrawal affect ECOWAS' ability to negotiate trade agreements with other regional economic communities? Will it have much impact? Again, I go back to the conversation around them not being a democracy anymore. Does that play a role in trade interactions?
ECOWAS can go ahead and do its negotiation without them. They have left ECOWAS. They are leaving ECOWAS. ECOWAS still have, out of 15, 3 gone. So you still have about 12 countries within the ECOWAS. So it's really not stopping ECOWAS going ahead to do any negotiation as a trading bloc with whichever country or regions they want to negotiate with. So their withdrawal will not really affect ECOWAS. ECOWAS can move ahead. What I think ECOWAS should be doing is to see, okay, look, what can we do to bring them back into the bloc? Now, I mean, ECOWAS is interested in them going back to democracy. For me, this probably is a sign that they are not ready to go back to democracy anytime soon. Probably because they believe democracy is not suiting them and they're not planning to get democracy anytime soon. And they don't want to be under any pressure to do what they would not like to do anytime soon. So instead of having to negotiate and discuss, maybe that's what they pull out. But I don't think we should leave it up. I mean, just ECOWAS should leave it just like that I think there could still be some diplomacy going on, negotiation going on, okay, what do we need to begin to talk about, or conversation we need to begin to have for them to come back into ECOWAS rather than leaving?
We certainly hope that will be the case, but we know there are the issue is really hydra-headed. The fact that they're not a democracy and they're not looking to do that quickly is a concern. What possible implications could this have for other countries within the ECOWAS that's considering a similar exit? Some might even be democracies.
I mean, a country that depends a lot on West Africa for trade, it won't be a good one for them to want to pull out. Like I said, I think it's easy for this country because they are asking themselves, these guys are shipping to us. They are taking a lot of opportunity from our market. We are not doing a lot of trade with them. So even if we pull out, we are still going to do business with the country we are currently shipping to. But any country thinking of this will not be a country that is doing a lot of trade within the economic bloc, because that will have a far-reaching implication and impact on them as a country. It will only be, any country thinking of it will be a country that feels, look, if we pull out, what are we even getting from this agreement in the first place? Are we even getting any benefit? Mainly countries that I think are making a lot of benefit from this agreement are Nigeria, Benin Republic, Togo, Ghana, Cote d'Ivoire, and the like. Some other countries are probably not enjoying a lot of benefit from this trading bloc, and maybe they will probably thinking of that. I don't know if any of them is thinking of this, but I think in terms of trade, anybody that wants to pull out is going to ask itself a very important question. What is the implication of this on my GDP? Because I'm doing a lot of export to these countries.
Yeah, you're quite correct. What implications could this also be? I'm talking about the exit now. For other countries within the ECOWAS, the perception of ECOWAS as a reliable business, just as a reliable business initiative, if you want to have agreements, you know, trade partner, for instance, with other African regions. I don't know if I mangled that question. I don't know if you got it.
Yes, I get your question. It's of concern, no doubt. It's of concern, no doubt. Any trading bloc that is trying to deal with ECOWAS, maybe Asian, maybe NAFTA, NAFTA, which is now US, Canada, and Mexico, or EU, any trading bloc, this definitely will be of concern because you are looking at about 15 countries together doing business with them. Now they are reduced to 12, and maybe the possibility of other people pulling out. Of course, it will be a concern to anybody that wants to do business with the bloc. But maybe what they would then consider is, I can do business with the bloc and probably consider the country. The challenge is this: as a unit, as a country, you really cannot do so much. To the extent that the population is very small, the GDP of the country is very small, per capita very small. So it really, unless the three of them want to come together to form a different trading bloc to be able to deal with whatever country they want to deal with, but it's really not wise for any country. I mean, this era of integration, era of globalization, it's really not wise for any country, particularly for countries that are small, particularly for countries that really need to do a lot of trade and need a lot of agreement to make that happen. It's not a good decision. And of course, this exit is definitely not painting ECOWAS in a good light.
All right, let's see if we can, I know we're talking trade, but I mean, a reconciliation wouldn't be a bad idea. What specific steps can be taken by ECOWAS to encourage this country to reconsider their decision to withdraw? Would that be something that you think is doable?
I think ECOWAS will reduce its stance on democracy, but rather a modified version of democracy that is good for Africa. There's a challenge with democracy in Africa. Democracy is good if it's practiced in the strictest sense of the word. Democracy is good for an environment where the majority are enlightened. But in an environment where the majority are impoverished and the vote is the same, one person, one vote, a person that is impoverished, that cannot think beyond a meal, and with a meal he will take a decision, will have the same vote as someone who will take a decision, right thinking mind, not based on what he will get, but based on what is best for the country. That is the shortcoming of democracy. I think Africa needs a version of democracy that works in Africa. So I think ECOWAS should reduce its stance on the fact that they must practice democracy the way we want it to be practiced. Rather, a version of democracy they believe is in their own best interest, not just what the West have given to us. So we should not
the argument can be put.
The negotiation, but should not insist they have to practice democracy the way we want them to practice it.
I mean, the argument can also be put forward that it's not really about democracy or some pseudo or kind of democracy that we must practice. It's about leadership, the kind of leadership that we have in Africa. However you look at it, it's still the same people we're recycling. So even if you say we want to practice some kind of pseudo democracy, it's still from this pool of leadership that we're getting. So at the heart of everything we've discussed today, it still boils down to how will the leadership of ECOWAS take on the responsibility of trying to manage this crisis in such a way that it doesn't affect the region, trade and security-wise. I guess that's where we'll be living it. But before we go, your final thoughts on the subject of integration in Africa and how ECOWAS can better manage this crisis with the three countries so it doesn't impact the region negatively.
ECOWAS should not be silent when any of its members is not doing right. If there are agreements on what should be done, and a member of ECOWAS is erring as a country, even if the country will not listen to ECOWAS, ECOWAS will not keep quiet why that country is doing whatever it is it wants to do to its people. For example, maybe the people are callous to their people, they are doing things against democracy, even as a government who is in democracy. ECOWAS should not be silent, so that when issues like this happen, they know that ECOWAS has always been on the side of the people, not on the side of those in the government of that nation. And that will speak to the fact that ECOWAS might have to find a way also of funding itself in such a way that it can be independent-minded, not being unable to speak true to power, particularly when a member of ECOWAS, that is a member funding the particular bloc, is erring and they are unable to speak to them on what they need to do right.
Bamidele, it's been an absolute pleasure speaking with you. Thank you for the insight you provided.
Thank you very much for having me.
All right, and that's where we wrap things up on One Slot today. Thank you very much for your kind attention. I hope the conversation had some impact for you. Join us again next week if you did. I'm Felicity Ezewike. Good evening.